Good afternoon to the listening and viewing public. I'm Stacey Carmichael with yet another COVID-19 update. Today, of course, I'm joined by Minister of Health, the Honorable Dr. Frank Anthony. Minister, it's a pleasure having you again on the program.
Thank you very much for having me, and good afternoon to
Thank you
and to all your viewers.
Thank you. Now, let's get the ball rolling with a very pertinent question. What could you explain to us what is the connection between the number of cases that we're seeing in Region 4 and the prisons?
Well, first of all, you would recall that maybe about a week ago, two persons from the prisons, that's Lusitania prison, tested positive. And since then, we have been working with the prison authorities to put in measures to mitigate against the spread. Unfortunately, in that specific area where those prisoners were, it was overcrowded, and therefore it was a challenge to put all of the mitigating measures. A couple of the prisoners subsequently complained of having some signs and symptoms typical of COVID, and the prison doctor there informed the Ministry of Health, and we were able to deploy a team earlier, late last week. And that team, we went in, we were able to screen a number of persons. We actually, I think, did take samples from about 200 persons or so who are in the prison. And of those, about 120 persons were tested positive. We have since isolated those persons, so they're no longer in the general population. They're separate from the other persons in the prison, and we are going to observe them to see whether or not they develop any further signs and symptoms. And once they have passed the 10 days plus 3, they're going to be discharged. If any one of them develop further symptoms, depending on what they develop, we are going to treat accordingly. But as of now, all those persons who have tested positive have been isolated, and they're under medical supervision at this point in time.
Thank you very much, Minister. And there is a need and there's a call for the reinforcement of to call in on businesses to ensure that they adhere to certain guidelines, the COVID-19 guidelines. Could you just elaborate a little bit more on that for us?
Well,
please?
more and more what we're seeing is a very good trend, and that is a number of workplaces are actually taking guidance from the Ministry of Health, and they are putting in place their own guidelines for their particular businesses. So, for example, we are extremely pleased that the banks have taken, this position, and they are ensuring that their staff comply with COVID guidelines as well as their customers. All the banks pretty much have done this. We are seeing other business taking this more seriously. We have noticed that there are a few of the shops in Regent Street and so forth that are abiding by these rules. And we want to encourage other businesses to follow, the same trend. Why this is important? Because if businesses and workplaces become safer, then we will reduce the spread. If people abide by these rules, we are going to reduce the spread. And I think the more that people reinforce these messages, like hand washing, like keeping your distance, your social distance, and of course wearing a mask, the more that different people reinforce these messages, I think the more it would become internalized by our population. So it's no longer, it shouldn't feel as if it's something foreign or extra that you're doing. By now it should become a habit, and if you're not with your mask, then you should feel that something is missing. And I think that's important, because this is the new norm. This is how we have to live, at least for the next couple of months until we have a vaccine. So it's important that people take these precautions, and once they take the precautions, they will protect themselves, and when they go back home, they're actually protecting their family. So we really want to re-emphasize that, and we're extremely happy that businesses are working with us to ensure that their businesses and their work environment are safe.
Thank you, Minister. Now, a question that from a comment that we received: should people be concerned when they go to the supermarkets or in the shops and they buy items? Should they want to know if they need to take an extra precaution in terms of washing the bottles, washing the containers, whatever they're purchasing, the tin stuff and so forth?
Well, the thing is, what you want to look at is more the interaction that happens in an enclosed space. So if you're in an enclosed space, what you have to do is to ensure that you wear your mask and sanitize your hands. And I've seen a lot of the shops putting those measures in place. Now, you want to get into your shopping. You don't want to spend a protracted time within these enclosed environments, especially when they have a lot of people in them. So you want to be in there and out of there in the fastest possible time. Now, one of the things that people should also be aware of is that new findings that are emerging from the scientific literature is saying that if somebody with COVID sneezes or cough, then this can be, it's not just for this 6 feet that we're talking about, but it can also travel for the distance. So this is something that people need to be aware of, because aerosols, that is particles that are very tiny, smaller than the cough droplets that we talk about for people to stay away at least 6 feet from each other. Aerosols, by some estimations, can travel as much as 20 feet. They remain suspended in the air, in some cases for an hour. So if you have persons coming into such an environment who are not wearing a mask, sneezes, then those particles remain suspended for a little while. And if you're not protected by wearing your mask and so forth, you can possibly get infected. And it's the same principle why indoor dining is not permitted. Because again, when people dine indoor, they obviously would not have on a mask. But if any one of them is sick and they're emitting viruses, they might be asymptomatic, they don't know, or pre-symptomatic, and they emit these viruses, then it gets into the air. It can stay in the air as an aerosol, and you can get contaminated. So people who are dining, we have emphasized in our guidelines that there's a prohibition on indoor dining. So you shouldn't be sitting indoor and having your food. If you want to sit at a table, preferably you should sit outside, at least where there's an air current, so that things don't linger too long around you. And that's what we have been emphasizing, and we hope that people can abide by that, because dining in an indoor space can put yourself at risk. And I think that's important for people to know, because we have been getting calls. People want to reopen restaurants and things like that, but indoor environments can certainly put people at risk. So if you must sit down near a restaurant, do so outside where it's less crowded, and stay away from the crowds. We have seen too many of these food stalls and so forth where people are going, instead of them keeping their social distances. What they've been doing is they crowd up as if everything is normal. And I'm sure that, if you have an infected person amongst them, that would cause spread. So we have to be careful. And then there's some of these food stands that would sell beers. And so while people are waiting for their food or barbecue or whatever it is, they're having a beer. Now, obviously, when they're having a beer, they have their mask off. And that, too, is potentially an area where you can get infected. Now, all of these things sound like we're overcautious, but we are seeing that a lot of our working population, young people who are vibrant, up and about, they are getting sick. Many of them would remain asymptomatic, or some of them might be mildly symptomatic, but they're getting sick. And unless they start taking precautions, such as the ones that I've just stated, then we are going to see a lot of young people getting infected. So a lot of them, nothing would happen to them, but this thing sometimes can be like a lottery, because we have seen persons in the age group of 20 to 30 getting infected, getting severely infected, meaning that they ended up in hospital. And we have cases where a few young persons would have passed away. So this is not something to be treated lightly, and we all should take the relevant precautions to minimize our risk. I think this is very, very important, and we cannot overemphasize this point.
Thank you very much, Minister. Now for a clarification, some persons are wondering if they can be asymptomatic but also have underlying illnesses.
Oh, of course. So we have, when we are talking about COVID-19, we're talking about somebody getting the infection. Like with any infection, there's an incubation period, and when that incubation period finishes, then you'll see they'll have signs and symptoms, and then they'll recover, right? So broadly, you have these three main areas. But for a lot of people, during and after the incubation period, nobody is, when we say asymptomatic, instead of the person developing symptoms, we're not seeing that. But if you're asymptomatic, it does not mean that you're not transmitting, you're not infectious, because all the studies have shown that asymptomatic persons can transmit the virus. That means that they are infectious. And that is why there was a term that was coined called a super spreader. And what's a super spreader? A super spreader is someone who does not even know that they have the virus, and walking around quite comfortably, feeling that they're like a normal, healthy human being, but they're infected. And they will talk to other people, they would probably sneeze, cough, and whatever, and they can infect others. But because they're asymptomatic, they themselves, they don't realize that they're causing other people harm. So that's something that we have to be careful about. Now, you can have someone who got maybe a chronic disease, like something like diabetes, high blood pressure, or heart problem, or something of the sort, and they get sick with COVID. So those persons who have these other chronic illnesses would be at a higher risk for COVID-19. And we have seen among the persons who have had it in the most severe way, that these persons, many of them, they had underlying illnesses. In some cases, we have seen persons who had diabetes, we have seen persons who had hypertension, we have seen persons who had cardiovascular diseases. We have seen persons also who had other infectious diseases, such as TB, such as HIV, and in one case we had a person with malaria, right? So they had other underlying disease. And when you combine these two things, they can be deadly, or they can ensure that that person would be in the hospital, because these are now you're fighting off two diseases at the same time, and therefore, you're going to have a harder time managing with two diseases at the same time. And that is why we're seeing a lot of these patients coming into the hospital. So I just want people to be careful, right? If you know you have underlying conditions like whether it's HIV or other illnesses, or you have a chronic non-communicable disease like diabetes or hypertension or heart disease, then make sure that you take extra precautions because you are at risk. And older persons also need to take extra precautions because they also are at risk, right? Many of the deaths that we have seen so far, a very high percentage of those deaths are above 70. And if you take from 60 and above, it's even higher because, we have a number of persons who die between 60 and 70. And then 70 and above, it's probably we've seen the highest amounts of deaths in that age group. So these are things that people shouldn't treat lightly, right? Because around the world where this pandemic is raging, we are seeing similar things happening. And therefore, we have to learn from their experiences and learn from ours as well, and make sure we take the relevant precautions.
Thank you very much, Minister. Thank you also to the listening and viewing public. This has been another COVID-19 update. I'm Stacey Carmichael, and I was joined by the Honorable Dr. Frank Anthony. Goodbye for now.